Hello, welcome to the lecturer's desk. Get your medical thoughts cleared before you leave. And please don't forget to subscribe to the YouTube channel and turn on the notification bell.
Hello guys, welcome back to the lecturer's desk once again. Today we are going to talk about atrial fibrillation and the atrial flutter. Now, these two, how are you going to identify them, or how are you going to differentiate between them using the EKG graph? This is what we are going to talk about today. Now, these two, they are P-wave pathologies or P-wave abnormalities. That is a condition in which there is abnormal generation of action potential in the atria. Thereby, we cannot produce a proper P-wave and forming a different forms of what wave that is being called the flutter or the fibrillation. Now, let's look at something over here. When you take these two, the atria depolarizes more than it's supposed to do, and because of that, there is deviation from the normal heart contraction or the normal atrial contraction. Now, the normal atrial contraction in 1 minute is supposed to be 60 to 100, and in a condition in which there is more generation of action potential or more depolarization of the atria, the atria depolarizes or the atria contracts more than the 100. Are we clear with it? And because of that, instead of the atria contracting at a rate of maybe like this, it will become contracting at a faster rate. Now, when it contracts at a faster rate, we'll be producing more P-wave, and we cannot choose one particular P-wave, and because of that, we say there's an absence of a P-wave. Because of that, we say there's an absence of a P-wave. We cannot identify one particular P-wave on the normal EKG graph. Now, let's look at what happened. There's generation of a new wave. That is, more P-waves are generated, and this more P-wave generated has a name, and this is called the F wave. But the F wave for the flutter, we call it capital F wave, and then for the fibrillation, we call it small f wave. Now, why? This is the atrial flutter. For the atrial flutter, you'll be able to identify the P wave that have been generated. We have more one P wave, another, and another. We have generation of more than one P waves over there, and this more than one P waves over here generated, you'll be able to differentiate between one and another. But for that of the fibrillation, you won't be able to differentiate between one particular P wave from another. It gives an irregularity of the waves over here. If you check this part, there's various P wave generated. Here too, there's various P wave generated, and you won't be able to identify, distinguish one P wave from another, as we can see from the flutter. So that one is also a difference that you can use to differentiate between the flutter and then the fibrillation. Now, let's look at the atrial rate. Now, the atrial rate is the rate at which the atria contracts. The normal atrial rate is supposed to be 60 to 100, as I said earlier on. Now, if we take that of the flutter is 250 to 350. Now, so we get atrial contraction, which is from 250 to 350, and because of that, it gives us more P waves over here, and this P wave can be distinguished from one another. But let's look at for the fibrillation. We have 350 to 600. That means for the P wave of or the atrial contraction of the fibrillation, is more than that of the flutter. That is why we find it very difficult to differentiate between or to see one P wave from another. Are we clear with it? Now, look at this one. We cannot say this is a particular P wave and this is a particular P wave. But if you check the flutter, you see this is a particular one, this is another, and this is another. So this is also what? One of the difference or one of the criteria you can use to do that. Now, let's look at the ventricular rate. The ventricular rate is what we say the normal heart rate. Now, the ventricular rate for the flutter is low. The ventricular rate for the flutter is low. And this is the reason. For the flutter, there is a blockage of some of the action potential generated in the atria from at the AV node to enter the ventriculus. And what happens is when there is a blockage of the action potentials to enter the ventricles, there will be low generation of action potentials in the ventricles. Thereby, the ventricles will what? Contract at a slower rate. Do you understand? Or we see what? The ventricles contracting slowly. Now, let's look at the atrial fibrillation. For the atrial fibrillation, most of them enters the ventricle. And because of that, the ventricle does contract at a faster rate. You see, this one is what? Fast. Now let's check it over here. This is the flutter, and this is the fibrillation. Now for the flutter, we can see the distance between one P wave, one R wave to another R wave is what? Wide. And when it becomes wide, that means it takes a time for the ventricles to contract and also contract again. Now let's look at something over here. For this one, if you check the frequency, the ventricular frequency, you are going to get about 60 to 70. But let's look at that of this. If you check one R wave to another R wave, although it is irregular, when you check it, the frequency, it will be more than that of the flutter. So we say there's what? High ventricular rate at the fibrillation than the flutter. And then let's look at the R and then the R wave. Between R and R, how are you going to differentiate the flutter from the fibrillation? What happens is the R and R wave for the flutter is regular. At most occasions is regular. And then for that of what? The fibrillation is irregular. Now, we can see from here, from one R wave to another R wave has the same distance from another R wave to another R wave. But if you come to the down here, one R wave to another R wave is not the same as this R wave to this R wave. And you can also identify it from here. From this R wave to this R wave, it's different from this R wave to this R wave. So when you take the graph and you see irregularity of the R waves, it must also give you the first impression of what? Going for the atrial fibrillation more than what? The flutter. And one thing is, someone may ask what causes this. We have various causes of the atrial flutter and then the fibrillation, and most of them can be the heart diseases. There can be heart diseases. You can see the hypertensive cardiopathy. You can see ischemic cardiopathy, and also aging. As we grow old, you understand, we have the risks of getting these P wave abnormalities. And then someone may ask, how can we also treat this? One of the best way or one of the easiest way to treat this is to use cardioversion. So they use the cardioversion to convert the irregular generation of what electrical activity in the atria, so that it will follow what the normal pattern of the generation of what the electrical impulse throughout the heart. So this is basically what entails the flutter and then the fibrillation here. This brings us to the end of today's lesson. If you find the class interesting, please kindly like, share, and then comment. And lastly, subscribe to the channel so that we can motivate us and bring you more content of medicine. See you in our next video.